I'm here in support of Bill 2549. How long should we accept an unequal health care system that triages patients not on their medical needs but on their income? How long should we accept higher infant and maternal mortality for Black Rhode Islanders? How long should we tolerate a lower standard of care for people on Medicaid? Does living on low income make a person less worthy? My church, First Unitarian of Providence, along with other groups, hosted Sister Song, an organization promoting reproductive justice for Black women and all who face disparities in health care. Sister Song defines reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Separating reproductive care from the health of the whole person is politics, not science or justice. Bill 2549 promotes reproductive justice. It includes enhanced health care coverage for prenatal and postpartum care, including social services and family planning services for up to 2 years after delivery. It does not exclude abortion coverage from insurance, which is a political, not medical exclusion. Whether or when to become a parent is a life-changing decision. Does this decision belong to politicians or religions? Should we use Medicare denial as leverage to pressure some people not to have an abortion, regardless of whether they want to be parents? We should not accept an unequal health care system. Thank you.
Thank you very much for your testimony. Any questions or comments for this witness? Thank you all. Oh, yes, I'm sorry. Senator De La Cruz.
I've been hearing a lot of repetition on the insurance. I guess that we should have the same type of insurance for everyone. But my years on the planet and the jobs that I've had, different employers offer different types of healthcare services. So some employers have a very generous package that I've worked for, some don't have as a generous package. And there are procedures that I would love to have, like I'd love to have LASIK surgery, but that's not covered. And should I mandate that my employer provide that for me? This vision is absolutely essential, right? If I have to drive to the state house, I have to see, where the oven is, so I don't put my hand on the flame. So, and back to the point is that we already provide coverage for women, those who have need of an abortion in the instance of the life of the mother, if it's at risk, if in instances of rape or incest. And so the other reoccurring theme that I keep hearing is women need to be able to choose when they have babies. They absolutely can. They can choose, and they do choose every day. But that decision also needs to be made prior to the act. So thank you. Appreciate that.
No, I'm sorry. She didn't ask a question. She did not ask a question. She was making a comment. Thank you. Next up will be Tammy Brown.